Hello, we're in Phi-Sci 121. My name is Jasmine Yap and I'm in discussion 1F.
My name is Bree Navarro and I'm in discussion 1E. In our community project, we will be discussing Duchenne muscular dystrophy and its effects on bone health.
Just a disclaimer, we are not medical professionals and the suggestions we'll be making are based on research that we have already gathered. Please see the citations in the description below for more information.
Duchenne muscular dystrophy is an X-linked disease that causes progressive muscle degeneration and weakness due to the absence of dystrophin, which helps keep the muscle membrane intact. Although DMD is often characterized by muscle degeneration, dystrophin deficiency also contributes to poor bone health. Unfortunately, this impairment of bone health in DMD has not been examined in great depth yet.
Bone disease is a significant concern in DMD patients because it influences the patient's loss of ambulation and adversely affects their quality of life. Even though there are drug interventions to treat DMD, like corticosteroids, there may be unfavorable effects on bone health and bone mineral density, which we'll be discussing later in the video.
There are several mechanisms that contribute to the deterioration of bone health in patients with DMD. These mechanisms include progressive muscle weakness, chronic inflammation of skeletal muscle due to the release of cytokines, activation of osteoclastogenesis due to altered muscle metabolism, suboptimal bone calcium homeostasis due to immobilization. Although corticosteroids are often used to treat muscle degeneration in patients with DMD by reducing the chronic inflammation, corticosteroids may exacerbate the loss of bone density and quality. Other side effects of this treatment include delayed puberty with decreased sex steroids, impaired osteoblast bone formation and mineralization, and poor calcium absorption from the intestine.
Insufficient vitamin D stores are also detrimental for bone health because bone is not able to absorb calcium and maintain its mineralization. Poor vitamin D absorption is caused by corticosteroid treatment and reduced sun exposure from lack of outdoor physical activity. As depicted by this image, deficient bone mineral density increases the likelihood of fractures and causes severe crippling deformities and contractures, as well as marked lordosis and scoliosis.
There are several ways to improve bone health in patients with DMD. The pharmacological route would be taking bisphosphonates. Bisphosphonate treatment has become increasingly used to treat bone fragility in pediatric patients. Taken orally, this treatment enhances bone mineral density, improves back pain after vertebral fracture, and treats truncal instability. Bisphosphonate is well tolerated by most subjects.
Although corticosteroids have been proven to effectively treat muscle degeneration in patients with Duchenne muscular dystrophy, we believe corticosteroids should be taken in moderation and in less dosages to reduce its adverse effects on bone health. A non-pharmacological treatment would be addressing vitamin D deficiency. More sun exposure would be a good example, or vitamin D supplement droplet. Although vitamin D can be supplemented, the boys with Duchenne muscular dystrophy are already taking steroids and other medications. Therefore, the easiest way to ensure they are receiving vitamin D is to get sun exposure. It is also an opportunity to get fresh air.
Although interventions including medications are available, the best way to increase bone health is through non-medical interventions and family education. The Muscular Dystrophy Association, MDA, gives families of DMD patients support, and they have provided guidelines for orthopedic management in their guide for families. As muscle weakens, moving one's joints becomes more difficult. In this case, joints are at risk for becoming locked in one position known as contracture. Families can assist by making sure the wheelchair has sufficient pelvic support to ensure proper positioning and joint extension.
Wheelchair positioning and attention to posture should also be observed to prevent scoliosis. Families can assist by assessing the spine every 6 months if their child is non-ambulatory. Long bone fractures in DMD patients, in their legs specifically, are also a concern for bone health. Families can support their child by using anti-slipping socks and wheelchairs with anti-tipping if they're non-ambulatory. If the child is ambulatory, then handrails and guides along the walls can also help. Finally, it is important to educate families about the possibility for fat embolism syndrome, or FES, which is when a piece of fat enters the bloodstream following bone fracture. Families should go to the emergency room if their child is experiencing disorientation, short of breath, or has an increased heart rate following their fracture.
If you found this video educational and informative, please share this video to promote awareness of DMD and its effects on bone health. Our video shows that DMD is a multifaceted disease that affects the muscular and skeletal systems. Therefore, holistic therapies should be a continued focus in the future to decrease the side effects of current DMD treatments. There are still aspects of the disease that the scientific community does not have a complete solution for. So it is possible that better drug or therapeutic intervention will be discovered with more research and funding.
If you have a family member with DMD, be aware that of their bone health and discuss with a medical professional to find better treatment options for your child. If you do not have a child with DMD or you don't know anyone with DMD, please advocate on their behalf by spreading awareness about this rare disease. I plan to inform the members of my community service committee and share this video with them and have a discussion on our next meeting.
As for me, I plan to share this video on various social media platforms to promote DMD and its effects on bone health throughout my community.
Thanks for watching.